Hello, I am Lindsay Hart. I'm an exercise physiologist at KSB in the Cardiopulmonary Rehab and Stress Lab. Thank you for joining me today as I discuss Heart Healthy Month and the measures we can take to create a healthy heart and life. Cardiovascular disease, or better known as heart disease, is defined as heart problems that include diseased vessels, structural problems, and blood clots. 1 in every 5 deaths are caused by cardiovascular disease, and every 34 seconds, someone in the United States dies of cardiovascular disease. Fortunately, 80% of heart attacks are preventable, and we're going to discuss some of those factors. When regarding heart disease, there are 2 categories that determine risk. Controllable factors are exactly as they sound. They are lifestyle choices we can make to avoid heart disease. We will dive deeper into these in a second. The uncontrollable factors are those that increase our risk of heart disease and are out of our control. Age is the first one of these. Like most diseases, the older one is, the more susceptible they come to disease. It is important to know these signs and symptoms as we age. Gender is another factor in determining risk of heart disease. Statistically, men develop heart disease earlier than women and have a higher risk. Genetics play a huge role in heart disease risk. It is important to know family history and if it includes heart disease. If your mother or father had heart disease before the age of 50, the risk of disease is increased. It is important for those with family history to inform doctors and educate themselves on how to live a healthy lifestyle. One of the most important factors with heart disease is diet. Diet is medicine in terms of heart disease, along with exercise. Fruit and vegetables can actually prevent heart disease, and I'm sure that you've heard that a million times, but it is very important. You should have at least 5 servings a day of vegetables, which can seem like a lot, and it is, but there are actually some easier ways to get vegetables into your diet rather than just eating broccoli and carrots all day. There's green supplements, which are just you add them to your water, and you can get a few servings that way. And then there's a lot of substitutions anymore. So cauliflower substitutions, cauliflower rice, cauliflower pizzas, ways that you can kind of trick your mind into not thinking, oh, I'm eating lettuce. I'm eating something a little bit more fun. Also, another way you can sneak veggies into your everyday diet is like smoothies. You can take spinach and put them in your smoothie and then blend those in. You won't even taste them because it's a water blend, and then you have an extra serving of vegetables. Foods high in omega-3s are also great in reducing risk of heart disease. These are our fish and nuts. Eating more lean meat is also great in reducing your risk of heart disease. That's more chicken and turkey. Maybe swap ground beef out for a turkey burger here or there. A little goes a long ways. And beans are also great in reducing cholesterol. So those are great foods to eat if you're trying to live a heart healthy life. Now, some foods to avoid: high amounts of sugar. So high amounts of sugar are correlated with obesity. And with obesity comes higher blood pressure, and that increases your risk of heart disease. You really want to try to eat natural sugars before refined sugars. So natural sugars are in foods that are derived. So bananas, grapes, any fruit that sugar comes from that you don't add it. Those are okay in moderation. Where refined sugar, it comes in your cookies and your brownies. That is the sugar that you're actually adding into the food. You want to avoid those to avoid heart disease. High levels of salt in food should also be avoided. This actually increases your sodium, and then this increases the stiffness of cells in the arteries, which then makes blood pressure go up, which then can lead to heart disease. You should eat no more than 2,300 milligrams a day of salt. There are 2 types of fats: unsaturated fat, which is the good type. These are in your nuts, avocado, fish, and seeds. You can eat these in moderation. The other type of fat is saturated. You really want to avoid these because they cause plaque in your arteries, which then clogs them, which can then lead to heart disease. These types of foods are butters, fatty meats, cheese, and bacon. You should also eat processed foods in moderation. These processed foods contain artificial additives that can lead to diabetes, weight gain, and inflammation. Red meat is another one that you want to make sure you're only eating in moderation. So it is a great source of protein, but it does contain TMAO, which is a compound linked to heart disease. So when eating red meat, you should have it no more than 1 to 2 times a week, and your serving size should be about 6 to 8 ounces. Exercise is another factor that we can control. And exercise is essential for health. It isn't, like I said, exercise is medicine when reducing heart disease. I always say when you stop moving, your body stops working. So inactivity can be just as, if not more, of a risk factor than smoking. So what that means is sitting at a desk sedentary all day long can be just as dangerous as smoking cigarettes when it comes to your heart. You really want to make sure if you're living a sedentary lifestyle or work a sedentary job, you are exercising on the side. Getting some activity in is very important. Adults should exercise at least 150 minutes a week, if not more. And 2 of those days should be weight bearing. So that's your resistance training, your strength training, Pilates, just something that adds a little weight to those muscles and bones to grow them. Moderate to vigorous activity is 50 to 70% of your heart rate max. And I stole this from our stress lab here. So on here, if you select your age in that left column where it says age, and scroll over, it'll give you some parameters. It says 60 to 100. It doesn't go down to 50, unfortunately. But you want to take everything in that row from that yellow left is what you should really be in when it comes to your heart rate when you're exercising. Now, you don't want to approach 95 or that complete right column max heart rate. That is kind of a little bit of a dangerous parameter, especially if you're new for exercise. But that heart rate is what you should stay in when you exercise. And some different ways you can monitor your heart rate to kind of compare it to that. The first one is heart rate monitors. So Fitbits, Apple Watches. I know there's a Polar Beat that you can put around your waist and exercise with, and it calculates your heart rate, and you can look at it on your phone. Those are great and very accurate. Another method you can use if you don't have one of those is the wrist method. So what you'll do is take your wrist and you will palpate for that heart rate, and you will set a timer, look at the clock for 10 seconds, and count how many times your heart beated. Take that number and multiply it by 6. That is your heart rate in that moment. I know a lot of machines also have heart rate monitors on them as well. Our machines do in rehab where you can kind of just grasp the handles and then it'll calculate your heart rate. It's not the most accurate, but it's still a reading of your heart rate. A lot of people don't know, but exercise does not have to be all at once. It's not an all or nothing kind of thing. It can be in bouts throughout your day. So you can do 10 minutes of a walk in the morning, maybe 20 minutes of resistance in the middle of the day, and a walk at night. It doesn't have to be consecutive. It can be throughout the day. And the key to staying consistent in exercise is finding exercise that you enjoy. If you don't like running, maybe don't go sign up for a marathon if you're trying to exercise. Find activities like if you like to dance, take a Zumba class, or if you enjoy swimming, water aerobics is a great way to find exercise that makes you feel good and then you're not going to completely dread and then eventually stop doing. Another thing you can do to get more active is walk 8,000 to 10,000 steps a day. Like I mentioned, you could do 1,000 or 2,000 in the morning, maybe some at lunch, maybe some at night. Just making sure that you're staying active throughout the whole day. And another key point I have here is to invest in your health. A gym membership is not cheap and eating healthy is not cheap. But if you accumulate one of these diseases later in life, it is also not going to be cheap. So really taking the time and money, if necessary, to invest in your health and exercise and diet. There are some things you can do. There's a lot of free videos online you can exercise to or find yourself a walking buddy. It's whatever works for you, but definitely find the time to invest in yourself. Tobacco use is another risk factor that we can control. Tobacco increases the formation of plaque in blood vessels. Cigarettes contain chemicals that cause blood to thicken that could cause clots in veins and vessels. Cigarette smoking doubles the risk of heart failure. So 1 in every 5 men that smoke will get heart failure, and 1 in every 10 women that smoke will have heart failure, according to the American Heart Association. Tobacco is responsible for 20% of coronary artery disease deaths. I put a couple of resources at the bottom of the screen here if you're watching this and considering stopping to smoking or just need some tips. High cholesterol and hypertension are predominant risk factors of heart disease. So what this means is if you have high cholesterol or hypertension, high blood pressure, you are at more of a risk for heart disease. So you want to avoid and really control your cholesterol and your blood pressure because that does increase your risk of getting heart disease from there. High blood pressure causes damage to the arteries. It does this because the damage makes those vessels less elastic, and that decreases blood flow and oxygen to the heart. People that are susceptible to high blood pressure are obese or overweight people, too much salt or potassium, inactive people, and excessive alcohol. High cholesterol can cause difficulty of blood flow through the arteries, and that's because they develop fatty deposits which lead to buildup in arteries and clog them. People that are susceptible to this are ones that eat too much fatty food, obese or overweight people, and those that are inactive. So some of the signs and symptoms of heart disease are chest pain, chest tightness, shortness of breath, pain in jaw, neck, throat, heart palpitations, fast or uneven heartbeat. This is not all the signs and symptoms. It's just the most common. There are some other ones that people do experience with heart disease, but I would say these are the most common. So I thought I would discuss cardiac rehab and what we do here at KSB a little bit. Cardiac rehab is a medically supervised program designed to improve your cardiovascular health if you have experienced heart attack, heart failure, angioplasty, or heart surgery. So here at KSB, we take patients who have had a recent cardiac event, and we exercise them through 24 to 36 sessions, depending on the event and how long they want to engage in the program. They come in and we hook them up to a telemonitor and monitor their heart rate as well as their heart rhythm. We also watch their blood pressure and oxygen while they're here. The goal of cardiac rehab is to strengthen the heart muscles back up after the event, but we also see a lot of improvements in weight, we see improvements in blood pressure, and we see improvements in resting heart rate. It is a great next step to take after a cardiac event to reduce your risk of having another event. All right, well, thank you guys for joining me, and happy Heart Month.